one of my first time.
Okay.
So yeah, I'm a little nervous, but it'll be fine. Right?
It'll be great.
Yeah, okay, good.
It'll be great. So
Okay.
Botox is one of the most popular things we do, especially in 30, 40-year-old, 50-year-old women. Males too, but we really do
25-year-olds?
25-year-olds, 20-year-olds. It's actually becoming more popular with younger people as a sort of a prevention, even for wrinkles starting. So it's nice. People love it. It's a lunchtime procedure. You can go back to work. You can, you just really don't have a tremendous amount of side effects, bruising, things like that. So it becomes something that people really like to do. Like Dr. Holt said, 3 or 4 times a year sometimes they'll come in and have it done.
Really? And what's interesting for me is, okay, so Katie was telling me she saw Today's Show and they had the millennials on and they were saying that there's no stigma to it.
Right.
Right?
Right.
But I mean, for us, there's a lot of stigma.
Right.
But now it's become much more common.
I agree.
It's a preventative thing.
Yeah, I think people are getting a lot more comfortable with it. We talk about it. You realize it's not a scary procedure.
Yeah.
It's actually really quick. You can go back to what you were doing, and I use it. Dr. Holt uses it. We both enjoy the effects of it, and it's really
That's good to
hear. We had
hear.
a question on Facebook Live. It was, what are the side effects of Botox?
Well, there can be some immediate side effects, which are just a little bit of a bump at the site of injection, a little bit of redness, but that usually goes down within an hour. Probably the worst one is bruising, and like you were talking about, Katie, you can cover that up with makeup. Sometimes if we get too close, which we don't do a whole lot, we can get a little close to the eyelid itself. People can get a very temporary droopy eyelid, but that's very temporary. We a lot of times have eye drops we can use to actually counteract that, and so that the lid will pop back up. So we actually have what we call kind of a treatment for it if it does happen, but I think it's happened to me once in 10 years. It's just really rare. But
I
we
think
do
it's
talk
worth
about
the
it.
risk.
Yeah.
I'm ready to do it.
Let's do it.
Okay.
All righty.
Is it painful?
It's a little bit of a needle stick, but it's nothing worse.
Oh.
It's less than a mosquito bite.
Oh yeah. Well, like I said,
if you've ever had a mosquito bite in Illinois, right?
Yeah.
Once you've
That's
right. Exactly.
Nothing hurts.
Now I'm a little less tall than Dr. Holt, so I'm just going to put
Okay.
the chair down just a little bit, and I'm going to put you back. Are you comfortable?
Yeah, I'm very comfortable.
All right. Wonderful.
I'm gonna look 10 years younger, I think, right?
That's
15.
right.
Yeah. Well, let's go
Baby
prenatal steps.
Let's prenatal. Prenatal.
Baby steps. Let's just make you 5 years younger at this point. I love that she was 15. That's very, How about 2?
It's very positive. I'm a positive person. Oh yeah, I'll take that.
Yes, so there's your ice pack.
Okay.
I'll have you hold that, and I'm going to mark you as well. So, excuse me.
We have another question. It says the pricing seems to vary from place to place. What is an appropriate cost, and what specifics should we ask about units?
So
that's a good
a great question, whoever asked that. Units are pretty standard. When we first inject someone, like Colleen, if I've never injected you, I use very standard amounts of units. So we'll use about 20 units for this area. That's what the most of us do. Foreheads, you actually need a little bit less because that's a very thin muscle we're treating if somebody wants their forehead done. And the crow's feet, generally we use about 10 to 20 units on each side. So each surgeon is a little bit different what they're going to choose, but that's kind of standard dosing. Pricing is a little bit variable, and that just has to do with different plastic surgeons and how they want to price, but most of us price per unit.
Don't go to Groupon.
Yeah.
Okay.
But I think and you're also getting a plastic
offer
surgeon
a
doing
Groupon.
this
Don't
as
do
opposed to a nurse, or not to say that some nurses are fantastic.
Yes, I'd rather have
But
a doctor.
To be honest, if you're doing your face, you get what you pay for too. So I always tell people it's
We've
the
learned
plastic
that
surgeon is applying this, so keep that in mind too. Okay.
Okay.
My turn.
Yeah.
All right, so what we're going to do, similar, we're going to treat this area called the glabella, which involves the brow, and it makes your brow frown. Okay, so exactly. So we're going to knock that out, and so generally we do about 5 different injections here. Okay, and there's a little variability in how you do that, but now I'm going to have you go ahead and just raise your eyebrows like you're surprised. Okay,
Lots of lines
yeah,
there.
so we generally treat, in somewhat of a symmetric fashion. Again, this is a really thin muscle. You really don't need a lot of Botox up there. Okay, and then go ahead and smile for me.
Oh,
Okay.
let's load this one up.
And same thing as Dr. Holt. I like to go a little bit higher, but we do treat the crow's feet area. And if you want to have your bread basket treated, we can do that as well.
I want my bread basket.
Okay, all right. I don't want your bread basket.
No, I do. I do. I want whatever I
You
need.
don't want a bread basket.
You don't want.
Or don't want a
That's
bread
right.
basket.
That's right.
I want
You want to
treat
get
a
rid of your
basket.
bread basket.
Okay. So now for actual injection, you actually just little bit of alcohol just to prep the skin, okay?
That's good.
And
Just relax. Don't worry about us here, seriously, because you don't
Okay,
want
I'm relaxed.
yeah,
I got it.
it's all good.
Beauty. I mean, it's worth it.
It is. And you look pretty.
Okay, same thing here. I'm gonna start. Now I put my finger here just to keep my Botox above my eyebrow, which is where I want it. Okay. How we doing? Okay?
Fine, yeah.
Perfect. You're doing great.
Yeah, it doesn't hurt.
Same thing here. You feel my hand?
I think the mosquito's worse.
That's right. Especially in Illinois in the summer, right? Okay, so that's part one. No
That's a
bleeding.
lot.
You get an A+. Good
Oh,
job.
good. Wow.
Okay.
Katie blood.
And then we're
Oh,
gonna
that
do
sounds terrible.
your forehead. Now again, these are just really superficial light injections because people just don't have a lot of thick muscle up here.
Oh.
But it is a really expressive muscle, so we want to kind of knock it back, but we want to leave you with some lines
Yes, I want to have some
so you don't look like you're frozen, like we were talking
like the
about.
old days. They don't do
So
that
we kind
anymore.
of leave you with the ability, especially on the outer part of your brow, to go
Mhm.
ahead and be able to move that area, because you want to still do that, because that makes you look natural and human. When
I
you
can
still,
lift my
yeah,
eyebrow on the right.
Right,
Should
right.
I do it right now?
You can.
She loves
There it
that
is.
eyebrow. She loves it.
We might want to keep that. That's actually
She
it's
does.
cute.
She
It
does
is.
love
But
it.
it's- yeah, and then if I get
She
mad at the
uses it
kids, I
when
do
she thinks
this.
she's all cute.
That's right.
Or then I do this.
You're like, oh, yeah.
Okay.
She loves that eyebrow.
Here we go with the lateral part. Yeah, this one is a tender area, so I try to kind of just move through
Yeah, I
that
feel that a
quickly.
little bit more.
Yeah.
Doctor,
That's okay.
We have another
It's
question.
worth it.
Any
Don't
stop.
irritation for sensitive skin?
That is a good question.
As far as during injection,
Yes.
there can be a little bit of irritation, but no more, than just lasting a few minutes. It's not something, if you have something that can calm down your skin, put it on right after. A lot of times we'll use a little bit of ointment, or sometimes we'll use kind of a post-treatment sort of protocol where we'll put a little serum on, and that usually calms things down for people
They
pretty
probably tell
quickly.
you.
Yeah.
They
Yeah.
tell you that ahead of time, right? So then you
Yeah,
know.
exactly right. Thank you.
good.
Okay.
How do I look?
Good.
Now we're going to treat the bread basket.
Okay, now
so
I'm gonna be real
I'm gonna
quiet.
have you, yes,
talking.
I'm going to have you just look up, and I'm going to find you.
Can I close my eyes?
You can.
Oh.
I'm going to set the needle, and then you can close your eye. Go ahead, close your eye. I'm just going to inject just a little bit, just that much.
Oh, that's
Okay.
interesting. Yeah.
I've never heard of that.
All right.
I've never
But
heard of that
okay,
ever.
what does it do? The
Yeah,
bread,
tell
what
us
does it do again?
Let her wait.
What's
Let her
it-
concentrate.
Oh,
for a
yeah.
second.
Right. I'm right around her eye.
The
for
needle
crying out loud.
right by your
Allow myself.
eye.
I'm going to set it just like that. Okay, now go ahead and close. I'm going to just inject just a little bit. Okay.
You know, when Katie did it, it looked like it hurt, but that didn't hurt at all.
No, you're good. You good?
Yeah.
Okay. Wonderful.
Yeah, the
So
bread
much
basket.
easier
What are
than I
we?
thought.
So it essentially, there's a muscle that wraps around the eye that causes us to squint and do all sorts of things. And so when we just give a little tiny bit of Botox there, it just relaxes that just enough that it makes it look a little bit less tense all the time. You take down the tone of that.
Oh, because
We need our eye to close. We need our eye to blink and things like that. So we don't. Obviously, we want to maintain, what we should maintain for your function of your face,
Yeah.
and we just go after the muscles that we don't necessarily need to use on a minute-to-minute basis, and then we can alter those just a little
My
bit.
girlfriend.
We're
she's
not done yet, are
Her
we?
name is Meg Caswell.
What else
She's,
do you want to do?
oh wait, I'll tell you. She's just
Oh, wait.
Callie. Meg Caswell just joined. She's an HGTV.
Hi,
star.
Meg.
She has her own
Oh,
show.
hi.
She's
I
a
love
pretty big deal.
Meg.
And she said she loves her lower eye Botox, and that was
Yeah.
the first time I had ever heard of that being done. But
Wow.
she loves it. So
So
yeah.
why does she love it? Meg,
do you
why do
love
you
it,
love it?
Meg?
I'm just curious.
And Laurel asked if this was your first time getting Botox.
well,
It's not, Laurel.
it's been a long time.
It's
First
been a long
time in Bloomington getting
There you go.
Botox.
There you go.
Yeah, there you go. First
Yeah.
time in Bloomington.
Okay,
Yeah.
ask about allergies. Is your lower eye, if your lower eye is frozen, they can't help your eyes depuff, or can they help your eyes depuff?
Oh, like
that
a
mean?
puff down here? Is that
I
what
don't
she
know.
means?
What? But ask about allergies. If your lower eye is frozen, they can't help your eyes depuff. Is that true?
Probably it probably wouldn't. Botox wouldn't help that terribly much
would help it? What
if
would you
it's
do?
the puffy eyes
Oh,
or
for
from allergies.
Okay.
And speaking of allergies, we really don't have any known documented allergies to Botox, so it's a pretty
Great.
well tolerated in everyone. So
Okay.
that's good.
That's
All right.
great.
So are we?
So
are
we
you?
gotta do something. I don't know. She was talking about something else, right?
Well,
Do I need it? What do I need?
we were talking about what else can we do in somebody in our age group that's really popular, and one of the things we've been doing a lot of is fillers. Okay. And fillers are gels that we inject into the face that are actually very tolerated by humans, no allergies. We used to use collagen that was derived from different sources. Now we use one that actually is very human compatible. And so what we're injecting is something called hyaluronic acid that is found naturally in our joints. It pads our joints. And so we're using a lot of that, different types on the market, but we use a lot of Juvederm here. But we're talking about, because you were a little bit to kind of fill this area in here.
Because what happens as you get older when this...
Well, we all have those lines there. If you think about your kids, we all have that line, but as we age, a lot of that soft tissue in that area starts to come down a little bit, and then this area looks a lot deeper. It's
and you
called
look meaner.
Well, someone asked the difference between, they said Botox or Juvederm, but isn't there another type that you can use as well?
Well, Botox and Juvederm are different kinds of things. Botox is actually a purified protein. It's called a neurotoxin. And what we're using that for is we're using that on muscle groups in the face to kind of temporarily suspend those or stop them from moving so much. A filler is just that. We're just kind of filling in a little bit of a deficit. We're adding volume back in places where we're starting to lose it. So we use it a lot in the lips. We use it a lot in face area here, in the nasolabial area here. It's been really popular now to start using it out here in the lateral cheeks, sort of the apple of the cheek, and that's a different, more long-lasting filler that we use.
Oh,
so
yeah, I see a lot of people
kinds.
that actually they have real nice cheekbones.
Yeah, so we just kind of plump up the cheekbone a little bit.
Would you put filler here? Because I noticed I've got a little bit of like...
You can, yeah.
My goodness,
so
like she's going to walk out a whole new woman.
along with our plastic surgery dictionary, we call those marionette lines. So those are just lines that start to kind of descend along the face as we get a little bit older.
I'm going to do whatever you think I should do.
Are those hereditary too, those little lines? Are they hereditary to get?
It can be. We all age a little bit differently, but I have a lot of patients that'll come in and say, you know, my mom has the exact same thing and I don't want that, you know, so I want to prevent that.
Right.
So.
And you need to start this now, right? Or at least, I mean, not for me, right? Because it is preventative, like you just mentioned.
It really, the idea behind fillers is to not take these lines away. The idea is just to soften them a little bit so that we sort of go down a little more gradually.
Okay.
Okay.
I like it.
So, yeah. So, and fillers, again, we make sure that we can get a little more bruising with fillers, so it is something you want to know if you're going to be on camera or anything like that.
Week.
Okay, all right.
Nothing.
That's the big concern because we're injecting a little bit of a gel. The Botox is a little more liquid, so we can get a little more bruising with this. So we do have to warn people. Makeup can help with that, absolutely.
Yeah, I think it's
All right, your husband just joined. You want to say hello?
Hi, honey.
So we're gonna just take
This is what I do, Greg. Okay.
Someone asked Dr. Randolph, do you prefer one filler over the other?
We do, just because, like anybody, we get comfortable with a certain filler. We like how it feels when we inject it. So I have different favorites, and I know Dr. Holt does for different parts of the face. If I'm injecting a lip, I'll use usually Restylane Silk. If I'm injecting the folds, I'll use Juvederm. I like Voluma out here in the lateral cheek or the cheekbone area. I like how that feels when I inject it. So I think they're all great products. It's very just surgeon specific or you know, provider specific.
And I know it hurts a little bit more.
Which one do you use?
I use them all. I like, for the lips, I like Juvederm. I'll use Juvederm lips. I'll use it for the nasolabial folds. I'll actually use Juvederm in the trough underneath the eye, and sometimes I'll use Restylane. For like the crease well, it sort of camouflages it, so you don't necessarily see that groove that comes down underneath there, the tear trough. I like Voluma for cheeks. I like Sculptra. I like Radius.
Wow, who knew there were so many
I love them all.
So Colleen asked if
yeah.
this was going to hurt. Now, here's the good thing about this. This gel has something called lidocaine in it, which is a numbing agent. So it numbs as it goes. And all of these fillers now have numbing agents mixed in with them.
Great.
So we don't have to worry as much about
it's
that.
much bigger needle.
Okay, don't look. Don't look. And all we're going to
It's
do...
a big needle.
Okay, so I'm going to have you tip your cheek up just a little bit.
Okay.
All right. So
Oh my gosh.
That's all right. So all we're going to do is we're just going to come in like this, and we're just going to, this is really not bad, and we're just injecting the gel as we go. How's that feel?
Well, it hurts a little bit more,
Okay.
to be honest.
And all
But
we're
that's okay.
doing is just we're following the line down a little bit. You can also do in the corner of the mouth. I know you wanted to do a little bit down here. So we're going to come right down on your lower lip. You have to take a deep breath. And then what I'll have you do is I'm going to have you put your ice pack on there afterwards, because that actually helps. And then that's it for that side. Okay?
That hurts a little bit more.
Okay, all right.
That was the
But
most
she did great.
She
She
did
did
great.
great.
Sister,
There
I've
you go.
never been so
Yeah,
quiet.
that's right. Yeah.
Well, I want her to
Put
get it
your,
right. I don't.
Yeah. So it's probably, the benefit of it now is it'll be numb, but as it goes in, sometimes it can be a little bit.
You know, I'm sure my cousins are on, or my cousin's on, Sheila and Maureen.
They're not, I don't think.
Oh,
But my friend
okay.
Laurel just said it doesn't hurt. She's done it before too. She's been
No,
doing
it doesn't hurt much. It just hurts a little bit.
It's
just
a little bit different.
It's
And
a
then
sensitive
someone said they're
area.
in pain
like
for
that.
you, ouch. But you know, it doesn't. You're fine.
No, I'm fine.
Yeah.
Yeah.
Yeah. It's more the.
I mean, it is a bigger needle.
Okay.
I mean, that's
You
okay.
just be
It's
the
worth
patient
it.
right now. Stop
I'm
talking.
Oh my God, that's all you. Everybody knows I'm like
Okay.
I don't
Seriously,
talk
be the
as much as
patient.
So I'll have
I'm
you-
happy to be the patient.
Here's what I'll have you do. I'll have you hold that there.
Okay.
Just
Little
like
blood
that.
there.
A little bit.
Yeah,
Little bit. Nothing to worry about. Okay. And we'll do the other side. Now.
Oh, our mother just joined.
Hi, Mom. Hi, Mom.
Hi. Mom, don't worry. They're taking
Come
great
visit.
care of
That's
us.
Right. That's right. Okay, same thing here. Chin up just a little. There you go. Now close your eyes. That'll be fine. So this is all we're going to do. Slow injections.
Someone said it's like a tiny ant bite, but doesn't continue to hurt.
Right.
Mom says so. I'll talk to my mom in a minute.
I'm not saying a thing.
Yeah, just
We're not in trouble, are we, Mom? We're good. We're doing good. And this, everybody has a little bit of a difference from side to side on their face, and this side on you is a little bit deeper, so I'm just putting just a little bit more there, but nothing crazy. Okay. A little bit more, one more stick, and we'll be done. There we go.
Who said it was an
that's-
ant bite? Because that is a great way to put it.
So
It's
kind-
an ant bite that goes away.
Yeah, so for people joining us, Colleen,
Yes.
or just
Hi.
joining us, we're here with Dr. Paige Holt and Dr. Randolph,
Hi,
who's
everybody.
working on Colleen's face right now. They're based in Bloomington, Normal, and they're plastic surgeons here who just take great care of you.
Hold on, hold on.
And if you're looking for someone in the area, they're great. I'll leave it
It's
alone.
great, everybody.
Ice bags and gauze.
Yeah. All
This
right,
is
well,
what
this
we
is
do.
great.
Well, it's going to be worth it in like 1 week. It's
Yeah.
gonna be
That's right.
amazing.
Now
Right.
she can go back to work, so
Yeah.
it's perfect.
No, I don't want to go back to work.
No, we're not.